Hi everyone, Ginger here. I have good news, which is the pathology report is benign, so I'm excited about that. I also, a few days ago, added myofascial release and lymphatic therapy to the PT agenda. I'm not yet really pushing, pulling, lifting, doing anything major with the arm. I did go back to seeing some patients, which was hard, but good. And then I had a little setback. I developed a seroma, and today I got 100 cc's of lovely bloody fluid pulled out of that, which is much more comfortable now because it was increasing pain and swelling. So if you're out there, a seroma it has a risk anywhere between 3 and 85% of what I've seen in the literature. So it's definitely not something to ignore. And I noticed what happened was I noticed a little swelling. It was like a pocket of swelling that almost felt like touching a water bed, very watery. Wasn't too bad, and then it progressed rather rapidly, and over a 24-hour period it more than doubled in size, and then began to spread and bring some pitting edema. Edema where if you press down and you move your finger, the indentation's still there. So make sure that you're paying attention to that. Never ignore any swelling at all. And so this morning I called my surgeon who worked me in right away. I have a wonderful surgeon, and she drained that. So now I'm resting. Now I'm not seeing patients today. Now I am doing what is really hard for me to do, as a self-employed mom of 3, and that's just to take a break, elevate my arm, maybe a little bit of gentle heat, maybe some range of motion in the ends, the distal part of my arm. I want to give a shout out to Robbie Burney, who is a wonderful PT who went through my program, my professional yoga therapist program, and she has worked in oncology and breast cancer for quite a long time, and she's just been a wonderful support. So Robbie, thank you very much, and for all that you're doing to help. So yes, the bottom line today is fluids, rest, elevation, and a little bit of gentle lymphatic drainage for that area to help out. So I'm going to do a massage to help work the lymphatic drainage into and towards the umbilical area, down towards the belly button. So that's about all I have today. Really, really good news, and a little red flag to wave, and just a word of support to all women out there who may be going through this but may not think that a little bit of swelling is actually to be concerned about. Swelling is always a concern, never anything to be ignored. And if you do happen to have some similar symptoms to me, my incision opened a little bit and was draining a little bit yellow. Fortunately, the fluid that was removed was not infected at all. It was just bloody. So I encourage you, don't ignore swelling. If it does feel like that, it's like a pocket. My incision's under my arm, and apparently seromas are more common there. So if you do feel something that to touch feels like, you're touching a waterbed, then I would definitely, follow up with your surgeon ASAP to make sure you get that taken care of, because you never know. It might need to be drained like mine was. It's quite a good size. So I will see you on my next video. This is day 8 out. Overall, I'm making great progress. I haven't taken anything for pain at all in a day. despite having this done. So I feel like I'm still on the up and up, I'm still on the mend, and I'll be back with some more tips when I get past this. One more point is oftentimes these things need to be drained more than once. They need multiple aspirations, so just keep that in mind too. So I'm going to be watching it closely, and at the first sign that it is filling again, I will get it drained again. So this will slow me down for a few days. But I did read the literature this morning, systematic review, a randomized controlled trial on intervention for seromas, and still early intervention physical therapy is recommended. It is not detrimental to or contributes to the development of seroma. Post-operative drains can help decrease the incidence, but I think that right now the jury's still out on if it is preventable at all. So you can do everything right and still get a seroma. That's kind of the take-home message. But still, light physical therapy, including lymphatic drainage and some range and elevation and a little bit of heat, is going to be my course of therapy for the day. You guys have a great day, and I'll see you soon.